Good morning. Today I have to discuss about resin bonded fixed partial denture resin which are cemented on the abutment using special resins. Composite resin bonded or retained fixed partial denture were developed from non-invasive micro retention techniques used in restorative dentistry. Coming to the introduction, Bonocor was the first person to introduce acid etching. Bowen in 1962 develops the bis gamma composite resin, a technique for splinting mandibular teeth using a resin bonded fixed partial denture. Was discovered by the Rochets in 1973. Since the resin retained fixed partial denture has gained considerable popularity in field of prosthesis. Basically, those dentures consist of one or more pontic supported by thin metal retainer placed only on lingual and proximal surface of the abutment. Retention in those processes relying on adhesive bonding between etched enamel and metal casting. A process that requires minimal removal of tooth structure, particular of abutment teeth that are intact and caries free. The primary goal of resin bonded fixed partial denture is replacement of missing teeth and maximum conservation of tooth structure, which locks mechanically into microscopic underlock present on etched enamel, undercuts present in casting. Coming to the definition of resin bonded process, a process that is rooted to tooth structure, primarily enamel, which has been etched to provide mechanical retention for the composite resin. Coming to the types of fixed partial denture: cantilever, fixed removable, and hybrid fixed partial denture. Cantilever bridge involves the using a single retainer. Abutment tooth may be entire, mesially or distal, less expensive but limited to replace one missing teeth. Fixed bridge, one or more retainers are placed on either side of the pontics. Differential movements of abutment can restrict in bond failure. The designs of bridge is indicated where exclusive movements of pontics cannot be avoided. Fixed movable bridge design is in two parts. Together may non-ridge attachment connector, which may be either reed or laboratory made, permits movement of two parts relative to each other in vertical direction mainly. Provides stress breaking action, should be used in short span and their opposing proximal walls of abutment can be prepared parallelly. Hybrid bridge, a combination of conventional one end and resin bonded retainer on other end of the pontics, indicated where one of the abutment is mainly restored and a resin bonded retainer is used at the site of conservation of tooth structure. The male part of the joint is often attached to the resin bonded retainer to simplify the maintenance where rebond occurs. Coming to the advantages of resin bonded bridges: reduced cost, no aesthetic needed, supragingival margins, minimal tooth preparation, and rebond possibilities. Coming to disadvantage, criteria for chewing of the patient was not described. Irreversible no space correction, no alignment correction. Plaque accumulation may occur because design is outside of the dimensions of natural teeth. Bulky contour may be intolerance in some patients. Not ideal for replacement of more than one teeth. Difficult temporization. Patient expectations of aesthetics and high, but routine results are not outstanding. Coming to the indications, adolescent with single missing teeth or traumatic or congenital, caries-free abutment teeth and good oral hygiene, maxillary incisor replacement in most favorable prognosis, and mandibular incisor replacement, periodontal splints, single posterior tooth replacement, prolonging placement of interim process to augmented surgical procedures like craniofacial anomalies. Coming to the contraindications, extensive caries, a patient with nickel sensitivity to base metal alloys, insufficient occlusal clearance to provide 2 to 3 mm vertical frictional retention in the axial walls, deep vertical overbite, inadequate enamel surface to bond, example extensive caries, existing restorations, parafunctional habits, incisor with extremely thin faciolingual dimensions. Types of resin bonded fixed partial denture. Based on the technique used to finish the tissue surface of the retainer, resin bonded fixed partial denture can be classified into Rochett's bridge, Maryland bridge, cast mesh fixed partial denture, and Virginia bridge. Coming to the direct bridge, also known as Richards or macro mechanical retention, provides macro mechanical retention. Richards was the first to design a resin bonded process in 1973. He was wing-like retainer with funnel shaped perforations with the base towards the tooth surface. He also used saline coupling agents for additional retention. This was one of the most widely acceptable design. Etching retainers coated with pyrolyzed saline showed up to 45% superior retention. The major disadvantages of Richards bridge is that resin exposed through the metal perforations is subjected to external stresses, abrasions, and micro leakage. Coming to the Maryland bridge, many scientists developed different designs to overcome the shortcoming of Richards bridge. Dumb and Richbrick used electrochemical pit corrosion to study ceramic bonding to base metals. Tanaka et al. Studied the retention of acrylic resins on metal copings. Finally, Latitis and Thompson from the University of Maryland School of Dentistry used dump study and developed Maryland bridge. Mechanical retention was developed by the micro porosities present on the tissue surface of the retainer. Micro porosities are created by etching the tissue surface of the retainer. Coming to the technique of etching, the suggested etching technique that can be employed while fabrication of Maryland bridge can be broadly divided into electrochemical etching and non-electrochemical etching. Electrochemical etching, here etching is done using the chemical electrolytes in presence of an electrical gradient. Before etching, the retainer is coated using the paraffin wax. The wax covered should cover the entire retainer except the area of the etching. Commonly used electrochemical etching includes for non-beryllium nickel chromium alloy. Etching is done in two stages. The first stage of retainer immersed in 3.5% nitric acid under the current of 250 mA by centimeter square for 5 minutes. Next, the retainer is cleaned by immersed it in 18% of HCl and ultrasonic cleaner for 10 minutes. For beryllium containing nickel chromium alloy, it is also two-step technique. During the first step, retainer is immersed in 10% H2SO4 under a current of 300 mA per centimeter square. The second step is similar to the one described on the previous technique. One step technique is single. Here the alloy is etched by the immersing the retainer into beaker with mixture of HCl and H2SO4. The beaker with the retainer is directly placed an ultrasonic cleanser for 99 seconds under electrical field. The technique increases the speed of etching. Coming to the disadvantage of electrochemical etching, it is expensive, very sensitive. The technique is very sensitive. Non-electrochemical etching. Commonly used non-electrochemical etching technique includes levidatis procedure technique, wherein nickel chromium barium alloy were successfully etched in a etching solution placed in water bath for 1 hour at 70 degrees centigrade. Coming to the advantage of non-electrochemical etching, does not require special equipments. Technique is comparable to more expensive technique. The process can be fabricated and bonded in two stages. Coming to the Virginia bridge, those are resin bonded fixed partial dentures which use particular roughened retainers. They are first proposed by Moon and Headings. The retainer wax patterns are fabricated using resin. 150 to 250 micrometer salt crystals are sprinkled on cast prior to resin fabrication. The salt crystals get incorporate on the tissue surface of the resin pattern. The salt crystals are dissolved and the resin pattern is invested and casted. Dissolved crystals will be produce voids in the resin pattern, is called as salt loss technique. Loss salt technique. Those voids will also be produced in the cast metal retainers and they helps in the mechanical retention. No surface treatments of the retainers is necessary. Air abrasions with aluminum oxide sufficient. Tanaka et al. processed few techniques to improve the bonding of these dentures. He suggested the immersion of retainer in sulfuric acid to for proper oxidation layer formation. For noble metal alloys, he suggested including a heat accumulated copper oxide deposition. This gives the necessary oxide layer. He also provided that air abrasions with aluminum oxide aids to improve the retention. Coming to the advantages, even noble metal alloy can be used. Surface metal of the retainers is not necessary. Coming to the cast mesh fixed partial denture, a net like nylon mesh is placed over lingual surface of the abutment teeth on the cast. It is then covered by the wax with the under surface of the retainer become mesh like when retainer is casted. Main drawbacks of the design includes the nylon mesh cannot adapted well to the cast during pattern fabrication. The wax may flow in between the mesh, blocking all the undercuts. Steps in fabrication of resin bonded fixed partial denture. Design of resin bonded process. Principles of abutment preparation and bonding of resin bonded fixed partial denture. Clinical procedure and cementation procedure we will discuss on next class. Thank you.